So today we're going to be talking about the cardiac cycle and some heart sounds. So we're going to start off with the cardiac cycle. So we know that our heart is a very vital area. It pumps blood throughout the entire body into your lungs. Um, it's it's basically what's pretty much keeping you alive at the moment. So some good words to remember are systole, or when the heart is contracting, and diastole, stole, when the heart is relaxing. So basically, when the heart is pumping blood through our body, it has this flow. I guess the best way for me to put it, but this fashion of contracting, relaxing, or pumping and not pumping. Usually, if you see a heart, on TV, you usually see it pumping or moving and kind of relaxing very fast. So some good things to remember, of course, is that the heart is a vital area. And the reason our V's and A's are in red is because I'm gonna show you a little way to remember this. And they have four main chambers that you really want to keep an eye on and remember, and that will help you throughout this entire cardiac cycle. Would be your left and right ventricle and your left and right atrium. So let's get started. So what happens is your blood enters through your superior vena cava, and from there it will enter the right atrium into your right ventricle, and from the right ventricle it will enter the pulmonary artery, which will then lead the blood to your lungs. From your lungs, it enters your left pulmonary veins, or just your pulmonary veins in general. From there, it will enter your left atrium, and then your left atrium to your left ventricle, and from the left ventricle into your aorta, and from the aorta, it goes out to the rest of the body. Now, when we go back, of course, the heart is the vital area. It's very crucial to our body and how we're living. So we have our V's and A's in red, of course, because it's a really good way to remember everything. So the blood enters through the vena cava, V, right there. So V into the right atrium, A, and hopefully you can see where I'm going. Into the right ventricle, which is V, pulmonary artery, A, to the lungs, of course, back through the pulmonary veins, which are V's, into left atrium, A, left ventricle, V, into your aorta, A, there you go, A here, and out to the rest of the body. And what's happening is the pressure that's in your heart is just opening and closing the valves throughout the entire heart. Of course, the tricuspid valve, you have your your aortic valve, and so forth. And they're just opening and closing these valves, and they're trying to make sure that the pressure doesn't overdo your heart, and just keeps a steady heart rate. So when we go to heart sounds, usually you use a stethoscope to listen to heart sounds. I'm pretty sure everyone has um, experienced the stethoscope touching their body. It's pretty cold. And what doctors are usually looking for are the lub dub sounds. And you usually know it by the pounding of the heart. What causes these are vibrations in the heart, that are caused by blood flow in the tissues, contractions and closing of the valves throughout the heart. And so your lub is basically your ventricular systole. And so your AV valves are closed during the time, and your duct is through ventricular diastole. And your pulmonary and aortic valves are closed. Excuse me. So what they do is they usually put a stethoscope near your um, intercostal spaces through your sternum, and of course they listen to it. Like I said, you've probably experienced it with the cold metal part touching your body. And these sounds indicate conditions in the body. So an example would be endocarditis. And what endocarditis is just inflammation of the endocardium, or the inner lining of the heart. And excuse me. the road of the edges of the valvular, cusp. So, as you can see in the diagram right here, you have your bacteria here, and it causes this inflammation and just infection on the aortic valve, just in valvular cusp. And what happens is that infection will lead to the cusp not closing correctly, and from there the blood could be leaking through, and then the doctor will hear a murmur. So that is just your little crash course on your cardiac cycle and heart sounds. If you have any questions, just let me know. Thank you.